Hi, my name is Emily Siangkam, and I am with the Program on the Environment and the Department of Geography at the University of Washington. I interned at Environmental Protection Agency Region 10, and my capstone is how pesticide risk communication can empower Indigenous communities. My work is important because pesticides can exist in or around tribal childcare facilities, and they are really just anything that is used to mitigate or control pests like insects and rodents. They can have impact with dizziness and nausea, but they can also have more long-term effects like developmental or reproductive issues. Since children spend a lot of time on the ground or maybe they're touching things, this can be really harmful to children's health and development, which is why we need risk communication. But very little pesticide risk communication exists specifically for Indigenous communities, and oftentimes they're the ones that are experiencing greater health disparities than other communities. So there's a need to develop and improve pesticide risk communication for tribes so that they understand the importance of this issue and how to reduce exposures for their children. So my research question is, what are the best practices of pesticide risk communication with tribes? So to tell you a bit more about my internship and what I did to answer my question, I interned at EPA and made 2 webinars for the Tribal Childcare Project, which evaluated environmental exposures in childcare facilities. And so to answer my question, I was researching literature reviews that discuss pesticide and tribal risk communication. And I was also interviewing people that actually directly work with these communities. And I found a good number of problems and solutions. Some problems were that people are actually regarding tribes as stakeholders rather than recognizing their tribal sovereignty. And also, there's not a lot of funding as there could be going into risk communication and environmental education. This would be used to promote public engagement and really help Indigenous communities understand the importance of this issue. Maybe that's through developing promotional materials or having kind of workshops. There's also the issue with prescribing rather than listening. So there's a lot of people directing on people on what they should be doing rather than listening to what people want to learn about and less collaborating as there could be. This is not to say that there isn't successful risk communication going on, but these are just some issues that people are experiencing in the field. So some solutions that I came up with are summarized in a pillar model over under the takeaways in figure 3, and that's value government to government relationships, allocate resources and funding, and create clear and culturally relevant information. So what does that actually look like? So one example is provide funding for tribe-specific pesticide programming. So one example of a program would be the Pesticide Circuit Rider program, where an inspector provides inspections for other tribes on a circuit along with their own. We can also provide trusted and representative liaisons, which would be members of the actual tribes, or they might be people that are working closely with the tribes and are trusted by the community. We can also provide funding that would help the tribes increase their capacity to address these issues. Furthermore, the broader implications of this study is that we can improve tribal health programs and associated facility inspections, and we can also facilitate government to government relationships and other environmental issues better. So this might be air pollution, drinking water, water quality, things along those lines. And we can also push for policy changes that include outreach and education and risk management. So since it's not federally required by Congress and other mandates at the moment, we could definitely push for things that would require them in the future. Thank you for listening to my presentation. I would like to thank Bethany Plew and Derek Trotter, my state supervisors, along with my faculty advisor, Dr. John Scott Meshke, my mentor, Dr. Ian Kroll, along with my interviewees, my family and friends, for the continued support and guidance. This couldn't have been done without them. Thank you for listening to my presentation. If you have any questions, feel free to reach out to me at esang23 on Twitter or sancom@uw.edu by email. Thank you.